Dr. Joyce from Pennsylvania for your 5 minutes of questions.
Thank you for yielding, Chair Eshoo and Ranking Member Guthrie, for convening a hearing on such a critical issue at an important time. We have seen tragic increase in mental health issues and substance use issues across the nation, and my home state of Pennsylvania is no exception. Exacerbated by lockdowns and school closures, these problems have been particularly acute among pediatric and teenage populations. My office has heard from Children's Hospital of Philadelphia in the east and from UPMC Children's Hospital in Pittsburgh in the west. And this covers east, west, and central. And it exists statewide, and it's not going to go away as we continue to feel the secondary impacts of the COVID-19 pandemic. As policymakers, we can't turn away from this crisis, and we must work together to make sure that physicians, mental health professionals are able to face these issues in every state. And to that end, I would like to thank Representative Sarbanes for working with me to introduce the Continuing Systems of Care for Children Act. This bill will reauthorize two important programs at SAMHSA, which will focus on comprehensive community health-based mental health services, as well as early intervention, treatment, and recovery services for children and young adults who struggle with substance use disorder. My first question is for Dr. Delphin Rittman. You have mentioned that SAMHSA supports the entire continuum of care and systems of care, and that for some patients, inpatient care is necessary. Does SAMHSA provide support for these inpatient services?
So inpatient services are not supported with the Community Mental Health Block Grant. And so I'd have to check back through all of our programs, but I don't believe we support inpatient services.
Does SAMHSA allow states to spend grant funding on inpatient treatment?
Again, the Community Mental Health Block Grant is primarily for outpatient, community services. And I do not believe that we have grant programs that fund inpatient services, but I will go back and check that for sure.
And I would appreciate that. If that is in the purview of SAMHSA, could you please provide us? And if the law is a barrier, is that something that we should look at when reauthorizing these programs, specifically not limiting bed numbers for inpatient hospitalization and treatment, which we've seen during COVID is so important. And as I mentioned, I hear from the hospitals throughout the Commonwealth of Pennsylvania how important these inpatient services are.
Can you repeat that question?
Absolutely.
Yeah.
If the law is the barrier, is this something we should look at when reauthorizing these programs?
We are open to, ultimately services and supports that help people get, connected to the care that they need. And so certainly happy to have follow-up conversations about what you've mentioned.
And thank you. I think that it's so important for this dialogue that the care that they need, Dr. Delphin Rittman, includes inpatient care, and your ability to address that and dialogue with us is so important. I think that the mental health crisis that we've seen throughout this COVID-19 pandemic has only accentuated the need for programs that do include inpatient beds. So if you could please follow up with us and let us know how we can better equip the facilities throughout America to provide those necessary inpatient programs.
Yes, we'll absolutely do that.
Thank you very much.
you.
Thank you, Madam Chair, and I yield.